what do you think is the most exciting thing in bone health that may be coming up?
Well, I think the most exciting thing for me is after a decade of talking about it, is that people are finally catching on. And it's becoming a priority for some of the societies. And we all go through phases. The latest fad is this or that. And fortunately, the latest fad happens to be paying attention to bone health, which, as an orthopedic surgeon, I can't imagine why you wouldn't do that. We're not just surgeons. We also have to treat the total patient. So it's always been a very important crusade for myself and several other people that are very prominent. Paul Anderson, Joe Lane that I mentioned, they're very, very excellent on this topic and probably know more than I do. But the bottom line is, I think the most exciting thing is the raising of the awareness of this problem, particularly in the general health and slowing down the fractures that happen from it. And the second thing is its potential application to successful surgeries. And we have, over the last decade, developed a whole broad range of marvelous medications that can actually treat it for the first time. And as a result of that, we understand bone health and physiology so much better to a level that we never did before. And that's really important because all of this genetic-based stuff that you hear about on TV and everything, this is probably the most practical application of that, is we've been able to decipher the very precise pathways in your body that calcium and vitamin D and all these things are utilized to improve your bone strength and bone healing and fusion healing and all these things. So that's probably the most exciting thing, is the onset of all the new drugs and stuff.